name's Brandon Hirsch. I'm an orthopedic spine surgeon in Phoenix, Arizona. Today I'm going to talk about the question of how do I define minimally invasive spine surgery. I think that minimally invasive spine surgery, the concept has evolved quite a bit over the years. I really think of minimally invasive spine surgery as being multi-pronged. So first is obviously the surgical technique. Traditional spine surgery historically has involved approaches to the spine where muscle was dissected off of the spine. Now in most minimally invasive approaches, the way that we get to the spine is through a muscle-sparing incision where muscles are not dissected off the spine, and that minimizes the trauma to the envelope of muscle around the spine. But I think really minimally invasive spine surgery as a concept goes beyond just surgical technique. I think it also incorporates a treatment philosophy where a surgeon goes to great lengths to identify really what is the precise driver of the patient's pain or disability. In some cases that is alignment and their deformity, but in other cases it can be a focal area of stenosis causing nerve root compression. And I think as a minimally invasive spine surgeon, it's important to understand really what is the patient coming to see you for, what is the reason that they are in your office. And for many patients, that is the reason they're there to see you is because of a very focal area of pathology. And I think the minimally invasive treatment approach focuses more on treating really the specific symptom generator rather than all of the degenerative pathology or all of a deformity that we may see on an X-ray or an MRI, because as we've learned over the years, there are many changes that we see on imaging that are asymptomatic for patients. So I think that's really an essential piece of minimally invasive spine surgery, is a very targeted and precise approach to treatment. I even think that going beyond what happens during the surgery to what happens before and after is an important element of being a minimally invasive spine surgeon, because the ultimate goal is to limit the morbidity, the pain, and improve the recovery process for the patient. And we've learned a tremendous amount in the last 10 years about analgesia regimens that can be given both before and after surgery that limit the amount of narcotics that patients have to use in recovery. And this becomes really important, not just because of the pandemic of opioid addiction, but also because we know these medications come with their own side effects that can lead to other complications. And so I really think that the concept of minimally invasive spine surgery encompasses muscle-sparing surgical technique, a hyper-targeted treatment approach, and modern methods for managing the patient perioperatively that result in the least amount of pain and discomfort, the fastest recovery for the greatest benefit.